Thank you for joining us for a discussion of responding to someone who is experiencing thoughts of suicide. This presentation is part of the Wisconsin Farm Bureau's Farmer Mental Health Series. It was created in conjunction with the Southwestern Wisconsin Community Action Program's Farmer Resilience and Suicide Prevention Program. It is important to note that this presentation provides only a basic overview of responding to someone with thoughts of suicide. Resources for receiving support are given throughout the presentation, and options for additional training are provided at the end. If you or someone you know needs immediate assistance, please call 1-800-273-TALK. That's 1-800-273-8255, or contact your local crisis hotline or dial 911. Before discussing action steps to take when someone is experiencing thoughts of suicide, I first want to talk about signs of stress, which can lead to a mental health crisis. Although we all have stress in our lives, sometimes the various stressors we face become overwhelming. When someone is overwhelmed by stress, we may notice that they exhibit certain signs. These can be physical or behavioral, and sometimes we can see signs of stress on the farm. It is important to check in with people experiencing these symptoms, especially if they occur or worsen over an extended period of time. Physical signs of stress may include changes in weight and appetite, more frequent illnesses, an upset stomach, poor sleep, including an inability to fall asleep or to stay asleep, clenching or grinding of teeth, chest pain, and a decline in the person's physical appearance. Behavioral signs of stress include increased worry about things you didn't worry about before, a loss of interest in hobbies and activities, withdrawing from previously enjoyable social interactions, and changes in routine, like no longer attending church or other community events. Of course, in light of the pandemic, all of us have had changes in our routines. However, as we begin to resume more normal activity, take note if people don't re-engage with their regular routines. Other behavioral clues of significant stress include increased forgetfulness, difficulty concentrating, and difficulty making decisions, relationship problems, feeling sad, agitated, or unusually irritable, and an increase in smoking or the consumption of alcohol. Additional signs of stress that we should pay attention to include changes to the state of the farmstead. Many farmers have a farm-first orientation to the world. When there are significant declines in the appearance of the farmstead, or if care of livestock declines, these can be indications that farm stress has reached an unmanageable point. Children may begin to show signs of stress as well. Of course, simply being stressed does not mean that somebody is suicidal. However, when you start to observe one or more of these signs of stress, whether they be physical, behavioral, or indications on the farm, it is a good idea to check in with them and see if you can offer any support. Sometimes it will be necessary to enlist additional assistance. We will now go over 5 steps anyone can take if they are concerned someone is struggling with thoughts of suicide. The first step is simply to ask. If you are worried that somebody may be wrestling with thoughts of suicide, the first step is to ask them clearly and directly if they are thinking of killing themselves. After you ask, take the time to really listen. Help them focus on their reasons for staying alive, instead of telling them your reasons for them to stay alive. Often people worry that asking directly will make the person angry or will put ideas in their head. However, there is overwhelming evidence that shows that neither of these things is the case. People who are struggling with thoughts of suicide are typically relieved that someone has noticed their level of distress, is willing to ask them about it directly, and most importantly, is willing to listen to them talk about it. After you ask clearly and directly, if someone tells you that they are having thoughts of suicide, It is important to determine if they have a plan and the means to carry out that plan. Over the course of your conversation, one of your jobs is to help that person figure out a way to stay safe. If there is an imminent risk of harm, for example, if the person has already swallowed a number of prescription medications, you may need to call 911 or to drive them to an ER. If you're uncertain what to do, you can always call the lifeline listed on this screen at 800-273-8255. One way to help them stay safe may be to offer to take possession of the objects that they are thinking of using to kill themselves. For example, you could offer to temporarily take any excess prescription medication that they don't currently need, or offer to temporarily take their gun for them. The third step is to be there. Usually we think about being there as meaning talking to someone face to face. However, in the current era of the COVID pandemic, this could also mean talking to the person over the phone. If someone is having thoughts of suicide, it is important that you give them the opportunity to talk about what has happened that is causing them to feel hopeless and in pain. Ask them to tell you their story. Listen non-judgmentally. This is more important than knowing what the right thing to say is. These conversations are hard, and you may feel uncomfortable. To be there for someone in pain, all that is required is that you listen with compassion and empathy. Let them tell you their story and listen for the reasons they have for staying alive. The next step is to help the person connect. Social connection is one of the most important things when working with somebody with thoughts of suicide. Part of what you want to do at this step is to help the person identifying ongoing sources of support. Ask them who they trust. Who else would they be willing to connect with? Good options might include family members, friends, neighbors, or faith leaders. Sometimes it is helpful to offer to make a phone call for them to reach out to one of these people and to let that person know that they need to come support the person you've been talking with. Connecting with professional helpers can also be valuable. The Farm Center has free counseling vouchers available to farmers and their families. The Farm Center also maintains a list of counselors around the state who have an understanding of agricultural stressors and who are used to speaking with farmers. After you have connected the person with thoughts of suicide to additional support people, remember to reach back out to them over the next few days or weeks. A simple text message, phone call, or card in the mail can let them know that you're thinking about them. This is powerful. Knowing that others care about their well-being can help support their own desire to live. To review, there are 5 steps that you can take when you're worried about someone who may be struggling with thoughts of suicide. First, ask them clearly and directly if they are thinking of killing themselves. If they say that they are, help them develop a plan that will keep them safe. Be there with them. Listen to their stories. Help them connect with others. The idea is to create a web of safety, so you need to get others involved. Finally, follow up with them. Additional information about these steps and why they are effective can be found by going to www.betheone2.com. Additional opportunities to learn more about suicide prevention and intervention training is available through a variety of mediums. Here are 2 trainings that you might consider. First, Living Works Start, available at www.livingworks.net/start. This is a 1-hour online training that will review helpful strategies for working with people with thoughts of suicide and also offer you opportunities to have interactive practice sessions with the online program. A second option is to attend a Qpr Training. QPR stands for Question, Persuade, and Refer. It is a recognized suicide prevention and intervention training for community members. These sessions are often offered in person in your communities. However, during the COVID pandemic, you may also be able to find a QPR session offered online. Finally, I'd like to point out that there are a variety of resources specifically for farmers. In Wisconsin, we have the Farm Center, which can be reached at 800-942-2474. The Farm Center, as I mentioned earlier, has free counseling vouchers and also offers a range of other supports to farmers. Harvest of Hope is a nonprofit that offers financial assistance to meet emergency needs of Wisconsin farmers. The UW Extension has a very good resource online called Resilient Farms, Families, Businesses, and Communities, and has segments on both dealing with stressors and on financial resources. The Suicide Prevention Coalition of Iowa County also has a range of information segments that are very useful. National resources include the Farm Aid Hotline and the Farm Crisis Center. Thank you for spending this time to learn some basic steps you can take if someone you know is having thoughts of suicide. Please feel free to reach out to me if you have questions. My email is listed on the screen.